All right, my friends, welcome back to another episode of the Professional Volunteer Podcast. And today I've got another great guest that I've been trying to link up with for a little while now. We're on opposite coasts, which always makes it a little bit more difficult. But I had thrown the question out there a few weeks back regarding volunteer EMS. I wanted to dive a little bit into volunteer EMS, and I had asked if anybody knew anybody that maybe would be willing to come on the show. And one of our faithful listeners, Dr. Michelle Kent from First Responder Health, mentioned Brandon. And Brandon is my guest here today. And Brandon, welcome to the show. If you wouldn't mind, introduce yourself and we'll dive into it.
Yeah, thanks, Chief. Appreciate it. I'm Brandon Heggie. I'm actually a patient of Dr. Michelle Kent, and she told me about this. She's like, hey, you need to call Brian and get something set up. So, so like Brian said, I'm on the other side of the coast. I'm actually up here in Western Washington State, and currently employed as a firefighter paramedic and on the short list for LT. So hopefully that happens sometime soon, but I'm not getting my hopes up. So been doing fire EMS for about 14 years now, a little over 14. So right out of high school, I was actually planning on joining the military, but I got a blood condition where there's like, yeah, peace out, figure out something different. So started volunteering and did that for about 5 years. And got picked up out of paramedic school as a career guy here at my local department. So other than that, I've been kind of all over the place. When I first started, I was all about fire, right? You get that pager and you're super pumped. I remember being 18 years old and just screaming down the road legally to the station so I can go to that first structure fire, which was actually my first call. So I want nothing to do with medicine at all. But then I realized it's like 85% of what we do. So I probably should get involved with it a little bit. And now I'm actually tailoring my side. I almost prefer it more. It's really a mind-boggling challenge to deal with the body and that type of stuff. And I can't handle doing the basics. So that's why I progressed from there, and I became a paramedic about 5 years later. So I went through IV technician and up to that. So, awesome. Other stuff that I've got to do. I was on our SWAT team as a SWAT medic for about 8-9 years, and reserve deputy with the sheriff's office, and work rope rescue, hazmat tech, literally bit of dabble in just about everything. So at least have somewhat of a knowledge about it.
Yeah, so you've definitely seen a lot of different aspects of fire and EMS, and even a little law enforcement dabbled in there, which is cool. Cool. So let me tell you why I kind of wanted to dive into this topic a little bit. Like you said, a lot of fire departments that have gotten involved in EMS, that's a majority of their runs. All right. Everybody knows, unfortunately, not unfortunately, but, unfortunately for firefighters, fires are down. Typically EMS runs are up. It's kind of like yourself. When I first got involved in emergency services, many years ago, I started with the fire department, joined as a volunteer. A few years after doing that, I decided I wanted to get my EMT, got involved with what was then my local volunteer EMS squad. And for a little while there, I kind of, even myself, I don't want to say I never left fire, but I got involved with leadership at the EMS squad. So I kind of went down that road a little bit heavier than the fire side for a couple of years. The one thing I always found frustrating about volunteer EMS was, or EMS in general, all right, but especially when you're not getting compensated for it, is everything takes a lot more time, right? So if I go out on a bullshit fire call, even till today, I go out on a smells and bells alarm, chances are, if it takes 20 minutes to 30 minutes out of my sleep, all right, that's it, whatever. I come back home, I go back to sleep. But EMS, depending on where you are, right, it's an hour, right? Because by the time you pick up the patient, get him to the hospital, get back in service, and that's if you're fairly close to the healthcare facility. I know in my area here, there's agencies that are 45 minutes from the hospital, so you pick up a BLS boo-boo in the middle of the night, you're out for 2-3 hours. So
Mm-hmm.
I've always felt that when we talk about recruitment and retention, which we talk about a lot in the fire side, but recruitment and retention in the EMS side seems to be even more difficult. And
Mm-hmm.
I've always felt that that's part of the reason why, because the time commitment is almost, or is, per call more.
Oh, absolutely. And like, just like you were saying, I mean, even just your total, your bullshit fire calls, 20, 30 minutes,
Sure.
your bullshit EMS call could be an hour. And that's even if you don't transport the patient, because now you got to go back and type up your entire SOAP report and cover your butt with all of the legalities of risks of leaving someone at home.
Yes.
But I totally agree with you. And some of the stuff I have written down is just the pure training requirements.
Mm-hmm.
So for fire, and things have changed. Different materials burn, different types of buildings, different codes, but the codes are making everything safer.
Mm-hmm.
But the thing that's constantly, and they're doing like all the laboratory work with burning and seeing how different types of ventilation work. But then you think about the human body and the amount of studies that come out daily that you should be keeping up on, because there's some things I can talk about in EMS right now that even people I work with are like, what are you talking about?
Sure.
And this is our full-time gig. So just dealing with that type of stuff, people are just busier in general. They don't want to put out that much more time, and running the bright red, big ass fire truck to fire is just a lot of fun.
Right.
But when you get on that on the ambulance, it's like, yeah, it's really not as cool.
Right.
So there might be that factor as far as the recruitment portion.
Yeah.
So.
Yeah. So there's the time commitment to the training. There's always continuing ed. Not that there's continuing ed obviously on the fire side too, but like you said, I still work some per diem shifts for our local commercial agency.
Mm-hmm.
And I don't work a lot, couple shifts a month maybe, but there's times where if I don't work for 2 months, it's like starting all over again.
Oh yeah.
Look, I my basic skills will always be there, but it's just, it's just getting back into the swing of things, feeling comfortable. It's not, if you're not continuously utilizing the skills and repetitively doing it every day, or at least a few times a week, I know for me, when I have a few months that I don't work, I'm like, oh Jesus,
Yeah. Can you handle this first one?
Yeah.
You take a little, slowly step back into it.
Right. But some of the challenges that I've seen here locally, and first of all, like we said, it's recruitment. Okay, so getting people involved, getting people to make the commitment. Some of the things that I see, and some people are probably going to be really pissed off at me for saying this, but you don't often hear on the volunteer fire side where it happens, but it doesn't happen that often, where the vehicles don't get out of the building, right? Where nobody responds, right? The trucks get out, right? On the volunteer EMS side, that happens a lot.
Oh, absolutely.
That happens a lot. And look, everybody works, and I feel that the topic we already discussed, the time commitment being that it's going to be a minimum of an hour, probably precludes people from leaving work, right? Like, I'll run out of work for a fire call, I'll leave, I'll be back a half hour later, nobody missed me. If I was going on an ambulance call where I was going to be gone an hour and a half, people are going to miss me,
Exactly.
But sometimes in talking with others, I feel that that's not always the case. Like, at 7:00 at night, why isn't the volunteer truck going out of the house? Why isn't that ambulance rolling? And is it a recruitment or retention issue? Is it the commercial?
So what did the pager say?
Right. Well, right. Yeah.
Exactly.
It's not a rollover MVA with, 17 patients and,
something everyone wants to see. It's a UTI patient that slipped in the bathroom and's covered all their stuff.
Right. Yeah, exactly. And that, that should be bothersome to some. Especially when your community counts on you. And that's what I think gets missed, I mean, at the end of the day, your community knows that there's an ambulance sitting in a building in their community, and they count on you to respond. Now, do they realize that you're volunteers? Yes, they do. But when they need you, do they realize that you're volunteers? Probably not.
No, it's just like you said. I listened to your podcast like since we first started talking about this. I've been like, I'm gonna go listen to all these guys. So it goes back to that, just the professional part. And like when I was going through my volunteer academy, my instructor straight up said, he's like, all right, all y'all are volunteers, yeah, but you're all professional. Right. And you all have that standard to meet. I get a sweatshirt from my union says Mesa County Professional Firefighters. Right. Well, it's not just the career guys that gotta be professional. It's like all the time. Sure. So the kind of the thing that we deal with here, like my department currently, we're a combo department, primarily career, but we're dead center in the middle of volunteer departments, and we provide all the ALS for like 900 square miles or something. Okay, sure. So those are all the guys I'm dealing with all the time because I'm on that ambulance now where I go out and help see all the volunteers. And there's so many times even now that I'll be the first one there from the career department because no one goes on their medic or on their aid car. So we handle most of that. And it just makes me think of why are we getting, how are we going to enlighten people to come out and, here's, are we gonna give them $10 a call, or what are we gonna do to kind of there has to be some sort of incentive to get people to come to the department and stay. I mean, because we talked about training, the legal responsibilities of being an EMS provider are totally different than a firefighter. Sure. And as far as, the patient care reporting, all type of stuff. So, I mean, I can get by working on my engine all day long as a firefighter, no problem. But you put me on even as an EMT on a BLS car, there's a lot more going with it. So, sure. I don't know. Are there any incentive programs over there on the East Coast, or they really know of, or is it more of a out of the goodness of your heart? Please.
If you're fire based, there's retirement programs, length of service awards programs, and I've had this discussion probably several times, but I think on the second episode I talked about recruitment and retention, and I'm not a big believer that length of service awards programs do much for recruitment, because an 18-year-old kid, a 21-year-old kid is not thinking about making $800 a month when they're 65 years old. Exactly. They're just, it's not in their brain. Now, there are other things that I've heard pay per call, that type of thing that is out there also, but I have not, and I could be wrong, and I'm sure somebody will message me to let me know if I am. I have not heard of anything similar for volunteer EMS, and I think there should be, because and I don't think it should be a retirement program. I think it should be a paid per call or some sort of incentive to get up and actually answer the alarm, not an incentive for when you're retired and you're not answering alarms anymore.
It almost seems like it's kind of like the personality you're dealing with individually, because if you have someone say, because I want to do this as a career once I'm obviously going to get in the military. So for me, if I was to come in, it'd be like, hey, we're going to cover all of your training, and we are expecting to be your stepping stone. Yes. So if you can, step on us, use us all you possibly can, that's awesome, because we're getting your service for, even if it's a short amount of time. However, it's a really good service. It's those people who aren't the stepping stone, they just want to kind of come out and help. So how, it's hard to really put out into words of how we're going to help that group of people. Right. So once you have their jobs that they love already, that don't want to get into full-time fire EMS, so it's, I guess, to me, I think that's the gap that we kind of have.
Yeah. So. Now, you mentioned that you work a lot with the volunteers in your area. So,
Mhm.
do you guys transport as well?
So yeah, so
Okay.
our agency, we do all the first out ALS. We do all of the pretty much all the ALS for the majority of the county,
Okay.
and we do the stat interfacility transports out of our local hospital. So we do all that, and then we have half a dozen agencies that are BLS transport capable,
Okay.
and
That are
then
volunteer.
they're all volunteer.
Okay.
Yeah, so there's a couple departments have a couple paid guys, but they're primarily volunteer.
Okay.
So we show up to those ones. Either we get a super enthusiastic crew, they're like, yeah, we'll totally transport this and go wherever.
Mhm.
Or it's the ones that are like, yeah, sorry, we got to keep our aid car available for our district, so we transport.
Okay.
But it all depends, and we're happy to do either, because either way, patients got to go to the hospital.
Sure.
So, but it's definitely changed over the last couple of years. When I first got started, and you can talk to all my other guys who are even senior to me, everyone was out there. Like you'd have 50 active volunteers in a department that
Mhm.
we only needed about 10.
Right.
And it's really gone downhill. And I think a lot of it, after speaking with a lot of our volunteers, is that it's that time requirement. Even though it's just
Yeah.
24 hours a month for us,
Mhm.
and I don't know, it depends what the other departments are, it's still a lot. I
Right.
mean, you have families and sports and school and everything else.
Yeah,
And
absolutely.
the fire department's just like, so why? I kind of think of this for the same way that I was a reserve deputy sheriff for the sheriff's office.
Okay.
I had to get a lot of my own equipment. They give me a vest, and I had to buy pretty much everything else. And then I would
It's
go
nice of
out.
them to give you the vest.
There's kind of a perk. Oh, and I got ammo too. I got ammo.
Okay.
So I'd go and I would go and I'd go on patrol, and I did tons of hours on patrol. So I actually got cleared to go on my own,
Mhm.
all free, nothing attached. But I'm like, why am I doing this? I'm like, primarily as a medic, I was going to back up my law enforcement buddies in case anything bad happened.
Right.
But at the same time, I'm like, I am doing all this for free. But there's so much legal responsibility on my side that it's almost stupid for me to do it.
Mhm.
And then I had a second kid coming, so I'm like, I should probably back off a little bit because I don't have any time.
Right.
But it's almost more than people want to bite off when it comes to the responsibility.
Yeah.
Because
Right.
I'm sure that you have, and I know I do. It's like, what? I'm gonna go work at Home Depot. just want
Yeah.
to take a break. Not no offense to people who work at Home Depot, because I actually think it'd be a pretty sweet job because I love doing that. But it's just like I just want to be done with it. And why would I put more on my plate that I want to be done with?
Mhm.
So, but then that's just that burnout.
Yeah,
Whole
for
another
sure.
episode.
Yeah. So let me ask you this. So your system is kind of similar. So I imagine there's times where the volunteer agency, even if it's their first due area, doesn't crew. They don't have the manpower, right? So
Yeah.
you guys come in and treat the patient, do the transport, what have you.
Yes.
How's the relationship? And we kind of talked when we talked about this a little bit before we got on air, right? How's the relationship between the career department and
first volunteer
versus the volunteer?
So
Because I'm going to correlate this to something after you.
Okay. So it's gotten better, a lot better.
Okay.
We actually had a private ambulance company in our town that we absorbed, and we actually are now doing all the ALS that they were doing.
Okay.
So now that we're doing that, our relationships are getting a little better because we're really working on our quality of care. And it's not just the patients we're treating right, it's everyone we're seeing. It's all of the departments, it's all the chiefs, it's all the volunteers. Because there is a political side to all of this as well, not just the patient care part. It's making everybody happy, and you're not going to make everybody happy. So, but now, like if I go out there, I'll be like, hey, who needs an IV? Who wants to learn this? And I'll just start rattling off stuff, and it's purely a teaching experience for me when I get to go out and work with people, and they really start to see that. And as long as people have a good attitude, everyone's really open to it.
Sure.
Our department, we're the big department in the county, so people kind of think they're I don't want to say we come across as know-it-alls. It's just we run 9,000 calls a year with 5 medic units. So and we're busy.
Sure.
Okay, maybe about 8,000. Either way, a lot.
It's a lot. Yeah.
Yeah. So, and we don't want to piss anybody off, or we're not trying to cause any harm. It's just we we have a specific level of care for our patients, and we kind of expect everyone else to do that.
Right.
But it's hard to have that expectation for people who don't get to put in as much time as we do.
Absolutely. Absolutely.
So
Yeah. Well said. Well said.
yeah.
So, and look, the reason I asked you that question is because I know in my small area, there's still quite a few volunteer agencies, and like I said, there's times where those agencies don't crew up. Maybe they'll get enough people to first respond, but not enough people to crew a transport unit, and that's backed up primarily by the one commercial agency
Mm-hmm.
services our county, right? Which I happen to work for part-time.
Yeah.
When you talk to people on the volunteer side, there's a lot of distension. Like you can hear, you mentioned the agency's name, and you could just, like, you can kind of see their skin, like their skin crawl sometimes, and I've never understood it. I've never gotten it, and it's the same thing that you just described, right? This agency does this every single day, 365, right? 24 hours a day, 7 days a week, right?
Mm-hmm.
There's people on staff. This is what they do. When the volunteer crew doesn't crew up, that's who's picking up the patient. That's who's taking care of the patient. It's not their fault that the volunteer crew isn't crewing up, right?
Mm-hmm.
And these people are all part of the community, right? They live
Mm-hmm.
in parts of the community, So I've never really understood, and look, I know part of it, there's some, like you mentioned before, there's some politics behind it
Mm-hmm.
that people will try to bring in, but I've never really understood that distension. Even when I went to work, they're like, "Oh, you're going to work for them." Well, what the hell does that mean? Why?
Exactly.
I don't even get it.
Mm-hmm.
So it's interesting to hear that that happens elsewhere,
Everywhere. Yeah, absolutely.
everywhere.
Yeah.
And one thing I'll say is, as somebody that's been in this for a long time, I do feel that EMS is underappreciated.
Hands down.
And I don't care if it's commercial, if it's a fire department based EMS that's career, or if it's volunteer EMS. I do 100% feel that EMS is underappreciated, and maybe that's a small part of why there's not more people that want to get involved and stay involved. Because look,
Mm-hmm.
if I go to a great big fire tonight, right, whether we make an amazing rescue or the building burns to the ground, chances are that's going to be in the newspaper tomorrow, or it's going to be on Facebook, or people are going to be talking about it. But when somebody gets up at 2:00 in the morning for a cardiac arrest and essentially brings somebody back from death, nobody knows about that.
Mm-hmm.
Yeah, it's crickets. So I do feel that that's a big part of that lack of appreciation falls into why some people are just like, I'll sleep through this one.
Yeah, no, absolutely. And it's actually funny because you literally, like read my mind, because I was thinking the same thing. I'm like, I don't think it's so much the professional or the career versus volunteer. It's the fire versus EMS. Yeah. Because, right now we just brought this EMS division over into my department, and we still have issues where we're not lining up. We have EMS guys that are kind of pissed off because this is going on, and we have fire guys that are pissed off with the EMS guys. I'm like, listen, we're same team.
Right.
So,
yeah.
Like literally the same team.
Yeah.
And why can't we, number one, work together? Number two, like help improve each other. And we all have to have basic understanding of what everyone's going through, because we have a medic unit that, runs 10, 15 calls a day, drives hundreds of miles doing transports and dealing with everything critical they possibly can, and an engine that might not move at all.
Sure.
So
yeah,
and so there's this huge difference in, it's like, well, hey, go get the gurney. Like, I know I used to work in a different county where it was, if you're working on the ambulance, you're outside with your hands, across your lap, and you sit there with your mouth shut and you wait to be told what to do by the fire guys, because fire guys were career guys at that point. Right. And I think it's, number one, a giant slap in the face to the EMS world, because the good majority of the time, the EMS guys know a lot more about EMS than the fire guys.
Right.
And
right.
number two, they're getting their butts kicked. And number three, we're all one big freaking family.
Sure.
So everybody deal with it and make each other better. So that's
absolutely.
Yeah. And I'm probably gonna catch some flack for saying some of this too, but hey, that's exactly how I feel about it. And I've been trying to get it out for a long time.
Yeah,
so.
yeah. No. Look, and I think, I think people that listen and really listen,
Mm-hmm.
will agree with a lot of what we're saying.
Mm-hmm.
Because a lot of the topics that I talk about on here do cross over, especially in the volunteer world, about
Totally.
professionalism, being professional,
Mm-hmm.
right? Just down to how we present ourselves.
Mm-hmm.
I don't care if it says volunteer after your town name or your agency name. When you show up at somebody's house, regardless of what you're driving, whether it's whether it's an ambulance or a fire truck, if
Mm-hmm.
you look like you just left the beach, who is going to take you seriously?
Exactly.
Seriously,
Mm-hmm.
you could put the best paramedic next to the worst EMT, and if the EMT is dressed for the part, before the paramedic opens his mouth, I'm looking to the EMT.
Absolutely. I totally agree.
Just because he actually looks the part,
Mm-hmm.
and so a lot of this stuff crosses over,
Mm-hmm.
and I say it to the volunteer service, as far as fire service goes.
Mm-hmm.
Keep a shirt in your vehicle. I don't know what to tell you.
Just a t-shirt. That's all you need.
Yeah, that's all you need. A t-shirt. I mean, throw your bunker pants on, throw your agency t-shirt on. You look good as gold.
Exactly.
Versus showing up with a wife beater and a pair of Crocs, and everybody's like, "Who the hell is this guy?"
Yeah, it's got my logo on it. It's cool.
Right. But but
Still.
same with EMS.
Exactly.
It's important, and
Mm-hmm.
and I think it says a lot for pride in what you do and how you represent yourself and the organization that you represent, regardless of what you're doing.
Absolutely. And it's we can do this for hours, but
that's usually the way it goes, by the way.
I know, it's like we have to have a cutoff. My wife's expecting me home at some point. So yeah, and I'm trying to think of how to go from here. What I'm got my notes sitting next to me, but you're spot on. It's that professional part, maintaining your standards, the expecting the most out of your own individualistic self for dealing with someone dying, which is kind of tricky sometimes, and that it's just really difficult. The other thing, and it's kind of been a hot topic for years, and I got a lot of, because I teach at conferences all over the country and stuff like that. And a lot of people I've met, the other instructors and just students and everything, we've always on the EMS side of things, there's this like, why are we still not yet considered EMS isn't considered a profession,
right? Or an essential service,
or essential service, exactly.
Right.
So
right.
Yeah, we're
Which
here.
is ridiculous.
Cool. It's
Absolutely.
awesome. Yeah. I went to school for a while for it. I'm not a doctor or anything. I didn't go to nursing school. Didn't go that long.
Right.
However, the stuff I'm expected to do in the field, nurses can't do.
Sure.
So
yeah,
it's like where is it going to start being taken seriously? Because I'm not just a paramedic. I wasn't just an EMT. I did actually rather important things. And when I get asked to come in and teach my advanced cardiac life support to a bunch of physicians, it's because it's what I do. Right. So like, when are we going to take this from being a ambulance driver job, which a lot of EMS guys they just hate that term, to a licensed, being able to travel wherever and work wherever, just like a traveling nurse, to getting paid respectfully, in that private ambulance business. They should be making minimum wage. Should be making way more than that. And like, I think if we can make it more of a career people are like, you know what, hey, we're gonna start recruiting out of high school. You know, if you don't like, you know, if you want to work into the healthcare field, let's not, you know, you don't want to work in the hospital though, let's start looking down this EMS side of things. Sure. And make it a little more appealing on the, not just the benefit side, but the social status side, because socially it's literally, hey, gurney fetcher, go get your gurney.
Yeah, I agree.
Not everywhere, but it's still present. And I personally can't stand it. And I know a lot of people that can't.
Well, no, and I don't blame you. There, and you know, underappreciated until needed. You know, that's what it is. Underappreciated until needed. Until somebody actually has to dial 911 and depend on somebody to come and help them and save their life, you're underappreciated. And the fact that, you know, an EMT and even paramedics in some parts of the country can make less than somebody that works at McDonald's flipping hamburgers is pretty sad. You know,
yeah.
I mean, I don't have to know a hell of a lot to walk into McDonald's tomorrow and get a job loading burgers on the fryer, right? But you have to know quite a bit to be an EMT and a hell of a lot more to be a paramedic, and that's pretty sad. You know, that's a pretty sad state of affairs.
Absolutely. So,
you know, I just wish on, and I don't want to paint everybody with a broad brush. I know there's people out there that are extremely dedicated on the volunteer side, give every ounce of what they have and as much time as they have. Unfortunately, a lot of these people don't have other people to back them up, and that's the problem. You know, so that divide that I talked about before, you know, when they don't crew and the commercial agency has to come in and transport their patient, you know, it's like, that's not their fault.
No, not a bit.
That's not their fault. They're just there to do the job that other people didn't show up for, you know. And when the pager goes off, you know, one thing that I know other people have sent in to me, and I've seen this happen over the years, you know. Look, if you're at a parade or a function or a meeting at a firehouse and the pager goes off or the siren goes off or however the hell you get dispatched goes off, it doesn't matter what the hell it is, right? Yeah. Everybody drops what they're doing and right, they're flying out of there, right? Could be in the middle of a parade in the middle of 4th of July. Everybody's gonna be standing around going, what the hell is happening? But we've seen where that doesn't happen with some of these volunteer EMS corps. It's like,
it's that guy again.
Yeah, you're letting, it's that guy again, and they're letting another agency come in and treat their patient, but then they're complaining about that other agency. But yet they had a full crew of people in that truck and could have very easily gone and taken care of it themselves. So, you know, these are just obvious things that, like, don't bitch about it.
Yeah.
You know, do it. You know, just do it. Fix the problem. You know, look, members don't grow on trees. We all know that, but we just have to do a better job. I think a better job has to be done at, you know, showing people, look, this is why we're here. Priority number one is what? The people in our community.
Exactly.
Right.
Yep. Calling for that, you know, that need where they don't know what they have to do. And it's our job to come in. It's our job to come in with all the knowledge that they expect us to have. And it doesn't matter volunteer, career, nothing. It's you are showing up as that first responder.
Right.
So
if Mason County wasn't professional, right, and it said volunteer after Mason County on your sweatshirt, and you guys sent out a big recruitment letter, right, asking for donations to fund your organization, and Mrs. O'Leary dials 911, and whatever the neighboring county, she just donated $100, right, and you guys don't show up, but the neighboring county shows up to pick her up in her time of need, isn't she going to be wondering, who are those people that I just sent $100 to last month?
Well, either be that or be like, wow, you guys just took a long time, but still thinks we're the same agency.
Right. Yeah, sure. So, absolutely.
Yeah. Everyone wears the same color.
Yeah.
So
yeah, for sure.
But,
no doubt about it.
Spot on. But going back to, like, you know, the legit, you know, the retention portion, I really do think that you have to identify some sort of incentive program. It's going to cost some money but it's hard to get people on their days off or they're, at work trying to, I got to get away for 3 hours, whatever.
Absolutely.
It's going to be very hard for people, employers, the families to deal with that EMS side when that is 80% of what we're dealing with, 75% wherever you are.
Sure.
And if we're able to do that and reach out, whether it's financially or scholarships or, you get some really freaking cool swag at the end of the year. It doesn't matter. There's got to be something.
Yeah,
because not everyone's going to do that job for free. Just like I don't want to do the reserve deputy, which is kind of like, being a reserve, there's a lot of reserve guys I know who would go out and their goal was to become a career guy. That wasn't mine. I was just there to help, but it's really hard to be in that position with that responsibility with no compensation.
Absolutely. For sure.
Yeah. So I think it's kind of the same feeling.
No, definitely. It definitely is. And I think, look, there's also better ways aside from coming up with some sort of retention program. I'm sure there's people might need to get a little creative. If you know that you only have X number of volunteers and you know that those volunteers are typically not available during the day, then why are we wasting the time during the day? If you follow what I'm saying, take those people, utilize them, maybe schedule them, maybe have a schedule. I work on Friday night with some, you and I are free Friday night. We sign up for the Friday night shift and we work from, we're on call from 6 o'clock Friday night till 6 o'clock Saturday morning. And it's our responsibility to take those runs, and work smarter, not harder. But, Friday during the day from 7 a.m. to 5 p.m. when we know that nobody's off, well, you know what? Again, going back to who are we there for? We're there for the patient. So you know what? Maybe we don't even waste any time. Maybe we give it to the next agency over or whatever and just let them cover it if they can.
Exactly. And, we have a bunch of agencies like, hey, we know all of our dudes are gone from 7 to 5. So neighboring agency, we know you guys have a bunch of people on during the day. So we're going to mutual aid you right off the bat, automatic aid for everything in these hours.
Yes.
Because we know it. And just being, proactive like that is going to save lives. Legitimately.
Absolutely.
So
don't even waste the 5 minutes to, try to get the, that core crewed up when they know that the people just aren't there.
Yeah. And the other thing we're seeing a lot more of, and, there's been a lot of changes where I'm at, is the amount of mergers and annexations and everything that are happening. So we're actually bringing a lot more departments together and they're covering a little more area, but they're actually having a lot better coverage and have more manpower and the funds are a little bit better. So by kind of doing that, that's helping out a little bit too.
Sure.
And we've seen a direct benefit in the last couple of years with the neighboring departments doing that. I think even ours, we went from a city department and a county district and put those two together in an agreement, and that's been exponentially helping every single constituent we have.
Yeah. Oh, absolutely. I mean, and look, that's the name of the game, and it's also being fiscally responsible, I'm sure, to the community and the area.
They're expecting a product, and everyone should be expecting to deliver it.
Absolutely.
Great. Yeah.
What else you got on your list? I know you got to have a couple more things on there. I want you to hit on them.
Okay, so legal responsibilities, training requirements, updating medicine, talked about that, dealing with bullshit, firefighters. Nope, yeah, we got everything.
Yeah, all right. Yeah. I'm surprised we didn't go longer on dealing with bullshit.
I'm telling you, well, it could be along the lines of bullshit from, fire versus EMS, or just those crappy calls that are about 85% of those 85% of calls you deal with, where it's like, this is not cool at all.
Yeah.
I am wiping butts. This is flu-like symptoms. It's been like, my career as a whole, like I'm the white cloud. So I'm like, hey, UTI flu, I got your back. Everyone's gonna be fine. So, but it's, I think your burnout's going to happen way faster with EMS than it is on the fire side. I mean, you run around in a pretty cool truck, but except when you're working EMS, you're dealing with everyone's whining and, but they're, could be legitimate pain, or you are just going to see that same person you saw yesterday 3 times, or it just stacks up against you. And it gets to the point where like, I am freaking done with this. So some people go on a hiatus.
Listen, no lie. I'll tell you flat out that when the agency that I was involved with back in the 90s was active, it was the busiest volunteer corps in the county at probably about, I don't know, 1,600 runs a year, which is pretty busy for.
That's pretty impressive.
That's pretty busy. And I'll be honest, I tell people all the time what made me lose interest, what made me finally just be like, I just can't. And I've always kept my EMT, but what I just said, I just can't do this anymore. You know, it was like getting up in the middle of the night, feeling like a taxi cab, you know, because people would know how to work the system. You know, you'd roll up and go out as a chest pain or something else, and you'd roll up and they're literally standing on the front porch with like their bag to go to the hospital, you know, and they had a stubbed toe or a cut pinky or something. And, you know, just doing that over and over and over again on a volunteer basis, I got to the point where, you know, I was like, this is ridiculous. I can't freaking do this anymore. I have no pride in this. I have pride in what I do. It's nothing prideful. There's nothing obtainable. Yeah. And look, there were plenty of prideful moments as well, but they were just overshadowed by all the bullshit.
Exactly.
You know, and
one thing I learned in paramedic school, my paramedic instructor was fantastic. And one thing he told me, he's like, you are learning, you're getting this paramedic certification to do something 4% of the time.
Yeah.
The other 96% is stuff that you're really not doing anything, but you're going to make a difference 4% of the time.
Yeah. Yeah.
So,
yeah.
Compared to, you know, what you would want to do. Like, I'd love to have a crazy call every single call, but we know that's not the truth.
Yeah.
So I guess
the
idea, the mentality that I like to have, and I really try putting this on a lot of people, especially when they start getting really separated from why we're there, is I'm like, hey, this lady, she wants to go to the hospital. Does she really need to go? No, she can probably see her doctor later. However, she wants to go. My job is to make that person happy. If it puts me out of my house and out of my bed for that much longer, you know what? So be it. Like,
sure.
You know, I have a patient who, you know, might have to go to like the children's hospital or something. I'm like, you know what? We're actually going to bypass our place because it makes more sense rather than having them sit in this hospital forever for us to use up an extra hour and a half of our time and drive to the children's hospital instead. Right. It's all about the person, the patient you're dealing with in the family. And if you can remind yourself that that's what that's about, you'll be able to go through this burnout stuff a little bit easier. Yeah. And but you have to constantly remind yourself. And it's very difficult at 3:00 in the morning. So when you've been up for 2 days.
Absolutely. You know, and again, I said it before and I'll say it again, definitely an underappreciated field wherever you sit in it, whether you do it for a career or you do it as a volunteer. You know, you know, as we've discussed, I definitely think there's probably some avenues that could be explored to get more people involved, even if it's a stepping stone to a career, you know?
Exactly.
But you got to have something to offer, and, you know, good morale and pride in your agency and, you know, working well with others, I think is an important thing to offer. You know, not negativity and screw those fire guys and screw that commercial agency and screw the, you know, who wants to be around that? You know,
and rather than doing that, and what I like to do is, you know, if I hear someone say, this goddamn department, I can't believe they're doing this again. I'm like, how about you step up and you help out? You teach them.
Right. Yeah.
I'm all about, like, if they call me I'm like, hey, you know, I do this lecture, I want to help you out. Would you have me in? I'll come do it for free. I don't care. But you need to know this stuff. I want you to be educated, and I know where this lack is. So let's gap it. It's no big deal. Yeah. You just don't have the quantity, and I want to make sure everyone's spun up. So that's kind of not really the attack, but the rebuttal I have to people who start bitching about things when they shouldn't be bitching.
And look, we all look. We all got to do a better job. It comes from both.
Oh yeah, no bitch
It,
every down.
yeah, it comes from both sides. You know, I know I'll catch myself sometimes. You know, if we're whatever, I'll give a good example. You know, if we're operating out on the highway and you know the ambulance rolls in and just kind of goes wherever the hell they want to go, and I'll be like, you know, I'll start like bitching to myself, you know, and then I got to remind myself, you know, hey, did you reach out to them this year and do like a joint training and review the highway protocol? And no, you didn't. So it's not
It's on you instead.
yeah, it's not 100% their fault. You know, like that's a new person. They were never taught. They don't know, you know?
Yeah.
So,
and we have to know so much stuff.
Yeah.
So jack of all trades, master of none.
Yep. We all got to do a better job at working together, I think, and just put the animosity aside.
Exactly.
I think that's a good,
good
way
totally
to sum it up. So.
I think that sums up just about everything that we just talked about.
It sure does.
No.
Yeah, Brandon, I appreciate you coming on, man. It's I know it's tough with your schedule and the fact that we got a little time gap and family and everything else going on.
No, we're late on your end, and it's dinner time on mine. So
yeah, lack of sleep, and you know.
God, that was But we were supposed to do this last week. That was rough. I was like, it's not going to happen, man.
Yeah, so that's all right. I appreciate you making the time, and if you wouldn't mind before we end, if just you know, tell everybody where to find you and.
Shoot. All right. So I'm on Facebook, Instagram, Brandon Heggie, Heggie. Instagram is like BD Heggie 3 or something like that. And then I also have a website and another thing, Triple Tango. That's my business of my education stuff. So nice. TripleTangoTraining.com, and still in the process of doing that. But I'll be going to conferences. I got a bunch canceled this year because COVID's awesome. I just got an invite for Texas EMS here in November. Wisconsin, I'm doing a virtual one. And I got a couple that got rescheduled for next year. So, but yeah, reach out. I'm the trauma guy primarily, doing stop the bleed, like advanced bleeding control. And I'm working on bleeding protocols from the local area for actually carrying blood on our ambulances. So I'm all, pretty much if you want to learn it, I'll learn it myself to teach you. So that's kind of my goal. So, yeah, reach out, Brandon Heggie Brandon H at TripleTangoTraining.com.
Awesome. All right,
so,
man. Thank you very much. I appreciate you coming on, and first dive into a little EMS. We'll see if I get blasted or it's welcome.
We could change up the subject next time. But yeah, let me know, and I'm more than happy to do this again. It's awesome. Thank you so much.
Sounds good, man. Thank you very much. I appreciate it. Stay safe and stay healthy, and we'll talk to you again soon. All right.
Will do, man.
All right, brother. Thank you.
Not a problem.